All right, it is quarter after, so we are going to go ahead and get started. Welcome to our next breakout session, ChatGPT AI in Public Health, a Game Changer or Cause for Concern. I am Laura Datner. I'm your moderator for this session, and I'm here to support our speaker and monitor the chat questions and time throughout this session. So we hope to leave the last 10 minutes or so for Q&A, but please feel free to ask questions in the chat throughout the presentation as well. So today we are excited to welcome Tracy Mehan. Tracy is the Director of Research, Translation, and Communication for the Center for Injury Research and Policy at Nationwide Children's Hospital in Columbus, Ohio. In this position, she takes the research generated by principal investigators at the center out of the journal and into the community. She also trains scientists and health educators on how to effectively talk about their science to audiences of all types. Her research interests are in health communication and dissemination science. And she is also the co-creator of the Center for Injury Research, Translation, and Communication, or CERTSI. So with that, Tracy, I will hand it over to you.
Thank you, Laura. I'm excited to be here today, and I'm going to jump right in because I have a lot of great information to share with you today. Okay. So how many of us got introduced to AI and ChatGPT? I thought I'd start there, which today is the 1-year anniversary of ChatGPT launching into the world and changing how many people perceive AI and what it can do. When it got launched, the first thing many of us heard about what this program is that this new program was available and students were using it to cheat. And that's what the conversation was around. And then really quickly, it transitioned over into AI passing medical licensing exams and news sites using AI to write articles and ChatGPT being listed as author and so many other things. And it just snowballed into this bigger discussion. But a lot of what we heard about AI, at least initially, in this time frame was about ChatGPT. That said, the reality is that AI has been used for quite some time. People just weren't necessarily aware of it. And it wasn't something that the general population had easy access to use. But now we have AI programs that are creating images and videos and sound and writing things for us and chatting with our customers, analyzing data, even reviewing x-rays and test results for earlier detection of disease. They're designing buildings and landscapes. They're helping us with our research, from helping us write grants to doing lit reviews, analyzing data, and even helping make the research more understandable to a wider audience. It can even help you plan a menu from what you have in your cupboard or recommend travel itineraries for you. So it is doing a lot of different things. And I support AI use. I want to start with that. However, there are some limitations and risks that I think many people are not necessarily aware of. So I wanted to have the discussion today about responsible use of AI programs and how we can incorporate that in being thoughtful. I also really wanted to acknowledge that the speed of change in AI spaces can be staggering, especially if you're in academia. Even how quickly there are programs that were developed. It's only been a year, and we'll talk about how fast, what the growth has been like and what that looks like. But these are big conversations that are having global impacts, and things are happening really quickly. If you looked at AI at all, if you're in that space, there were some big mix-ups, dust-ups that were happening with OpenAI, which is the company that launched ChatGPT. And within a matter of 4 days, they fired their CEO, rehired the CEO, fired the board, all kinds of different changes. Now they have a new board. It's staggering how quickly things are changing. But the company came very close to folding during this time, and that can have huge implications. It's billions of dollars are invested in programs using programs like this, and they're going to have a big impact. And we're going to talk a little bit about what that can look like for us. So just a quick overview, we're going to talk today about what LLMs, which are large language models, which is what ChatGPT is, what they are, how they work, why this is happening now, what some of the limitations are, what some of the ethical questions are, and some of the risks. And then we're going to talk about what it can do and some of the exciting things that are on the horizon and what we can do now. Okay, so what are LLMs? LLM stands for large language model. And the one most people have heard about is the AI chatbot called ChatGPT that was started by OpenAI. What you can do with these programs is you can ask it questions, you can have conversations with it, you can ask it to write things for you, you can ask it to write code. But it's kind of an interactive process, and it's the first time AI is in this way kind of accessible to the general public. And most people now, I think, have heard about ChatGPT, but there are many others. There's Bard, there's Jasper, there's Meta AI. Even just this week, Amazon launched their version called Q. They're similar, but each of them are unique. And so I wanted to talk a little bit about what that looks like and why. So GPT stands for Generative Pre-Training Transformer. A generative model means that it can make new things, like writing a story or a sentence. Pre-training means that it was shown a lot of examples before it started working with you. And a transformer is a special kind of computer program that helps the model understand what words mean and how they're related to each other. So imagine it's like a teacher that shows you a bunch of books and stories before they ask you to write. GPT is like that. It was trained on a lot of examples, and now it's ready to help you write. Okay, so as I mentioned, exactly a year ago today, OpenAI launched ChatGPT. And within days, there were, thousands, millions of people using it. But let's look at what this looks like. So in the history of technology advancements, the time to reach 1 million users is kind of a benchmark that a lot of people use. So Netflix, everybody knows Netflix now. That took 3.5 years to get to 1 million users. Airbnb took 2.5 years. Facebook took 10 months. Spotify took 5 months. Instagram took 2.5 months. iPhone took 74 days. ChatGPT got to 1 million users in 5 days. They got to over 100 million users in less than 6 months. And now a year out, they're at over 180 million users. And this is their general GPT. In early November, early this month, they actually announced the ability to create custom models. And already there are hundreds available, and it's only been a few weeks. And there's a whole marketplace where people can sell them or sell access to them. And we'll talk about why that is significant here in a little bit. But just thinking about how large language models work, it's really important to understand how they work so you can understand what you can and can't do with them. So there's this perception out there almost that when you ask these programs a question, there's this robot brain back behind the curtain that thinks about your questions, goes out and does some research, and then responds back to you with an answer that answers your question. That's not exactly how they really work. So I'm going to give it a description. This is a dramatic oversimplification, but it will get the point across. So these programs, they start with a set of source materials that are fed into the program, and then a complicated statistical model is developed to help the chatbot be able to use those source materials to develop answers to the questions that people might have. And then there are trainers that ask the model questions and then change the statistical model to help the program learn when it's getting the answers right and how to make the model better. Why does this matter? So understanding what goes into the model. Each of these different models are using different source material, and all of them are proprietary, so we don't know exactly what's being fed into them. ChatGPT says that they include some combination of web crawls, links from Reddit, books, some that are unpublished and some that are published, but they don't define which books they are. They use English language Wikipedia. And really important to understand, all of their source materials that they use were materials that were published before 2021. So we're going to come back to why that matters, but a lot of people don't know that. It was trained on only materials before 2021. Okay, so what does the training look like? So they look for patterns in grammar and syntax. The training helps teach the model patterns. So how to put words and sentences together in a way that's most likely to occur in human speech. They're designed to predict the next logical word. They're also looking at context. If you ask the question, what are bats made of? It needs to be able to know, are you talking about the animal bat or the baseball bat? It needs to be able to understand that. And then it also is looking at emotional tone. So you want to think of these programs almost like predictive text. So we've all had the experience of typing into Google and typing in a question, and you see how it starts to have these extra words where it's predicting what you might want to be asking it. This example on the right is actually just a screenshot of my phone using the predictive text. You can see at the bottom, based on what I'm typing, it starts to type it in. That is actually what these are doing. There's a question in the chat, do you know when they'll be using sources post 2021? So they are starting to learn from us, but right now they're not adding new data into the big models. But again, we'll talk about that a little bit more about the personalized GPTs. In terms of perception, so let's go back to that a little bit. So if you look at the left versus the right, there's this perception of intelligence of these programs. And this can actually lead potentially to lies or myths, truths. And I put these in quotes because they're not always intentional, right? It doesn't know that it's lying to you. It just is sharing the next logical word that makes sense. And they can sound very real, and they aren't. Even if you ask it for citations, and we'll talk about that a little bit more later. But, if you think about it, there's not this robot back there doing research. It's really just a statistical model that's guesstimating the best combination of words and phrases that will be most likely to deliver an answer based on the words you used in your question. So even how you phrase your question can make a difference. So what are some of the limitations and risks about these kind of models? So the models are only as good as what you put into them. So this really struck me when we were listening to Dr. Wright's keynote this morning, thinking about, structural racism and health inequities. Those can all be in these programs based on what is being entered into them. And the little bit of the danger that's in there is because we can't see what's being entered in there, we don't know what source material is being used. So we don't know what biases are in there necessarily, which can be a little bit scary. But so there can be biases, there can be misinformation, there can be selection bias based on which data is being entered into these models and what isn't, what's being left out, who gets to choose which source materials are in there. And even stereotypes, right? All that stuff exists in the data that we know is out there already. These programs are not going to stop that from happening. There's also trainer limitations. Everyone, no matter how they see the world, they're seeing it through their own unique perspective based on their lived experiences. And no matter how hard you try, you bring your biases with you, right? So we need to make sure that when we're training the models, we have a variety of voices and perspectives at the table. When they're training it based on what they think is a good answer, what their stereotypes are, what their speech and language patterns that they're comfortable with. So being aware of that can help us be better users. Here's just one example. It's a visual example, but it gets the point across. This happens with text as well, and there's subtle biases that can go unnoticed by some, and they're built into the program. So this was a prompt about creating an image where there are two paintings on the wall, and the left one is a royal raccoon king and the right one is a royal raccoon queen. But when you look at it, those are all the directions it gave. And what it came out with was raccoons that are wearing Western style royal outfits. So just being aware of that is important, right? There's also limitations on the output. Based on what you put in, it can have biased content that's put out. It's not original. It can be plausible sounding, but incorrect, which I think can be really dangerous. It can repeat phrases, it can be nonsensical, and it can even have harmful instructions, which in public health and injury prevention, we really need to be worried about. So there's some controversial uses that are already happening. There was an organization that decided to use AI for a mental health experiment, and they did not tell their patients they were doing it. So this guy posted about experience that they had. They used this platform that it was mental health. They were supposed to be talking to a provider as a patient, and it was interacting, but it was actually AI generated responses. Now, there were humans still overseeing it, but the responses were mainly AI. And what they found, interestingly, was that the messages composed by AI and supervised by humans were actually rated significantly higher than those written by humans on their own. The response times went down, and overall it seemed like it was a quote success, but they pulled it from their platform quickly because once people learned the messages were co-created by a machine, they didn't work anymore. So the phrase they used here is simulated empathy feels weird, empty. But there was a lot of controversy as to whether or not they should have disclosed up front that they were doing that as opposed to waiting until after. There's also some ethical questions, and there's a lot more that I'm going to get in than what I can get into here, but just some things to think about in terms of the source data and where it comes from. A lot of the data is scraped from other people's work and is being used without their permission. This is true of text, but it's also true of artwork, photography, music that are being used to create digital images and digital music. There are also people's data being used without their permission. And there have been some cases of biometric data being used to train programs when people didn't give permission for their medical data to be used. Are we okay with that or not? And what is that going to look like? There are examples of it spitting out content that is word for word from a site like Mayo Clinic, but it doesn't reference or cite that. What does that look like? And there's questions about writers, creatives losing their jobs to a program that essentially stole their work, and we have to think about that. There's also questions about responsibility. Who's responsible for AI mistakes and errors? I have an example here of a self-driving car, which Dr. Wright also talked about this morning. Who's at fault if the self-driving car crashes? And what are the implications when our training strategies are already showing, and we've seen that they don't recognize different skin colors as well as, so what does that look like, and how do we make sure those kinds of things aren't happening? In terms of plagiarism, who's responsible for deciding where the plagiarism line is? If we know they're pulling from data and they're spitting it back out, who decides where that line is, where this is okay or not, right? There's also inequality. So the costs for these programs have the potential to price some people out of using them. Some of them are available for free, are already, you can use ChatGPT for free, but there's a pricier model that's better and has more features. And who's gonna, how will the wealth that's created by these programs be distributed? Probably gonna be pretty unequal. And who's gonna lose jobs to these programs? Thinking about those types of things. We talked a little bit about the bias that is in the data that's being entered into the models, but there's also bias in how these programs are being used. There's software to detect future crime that showed bias against Black people. There's facial recognition programs that have harder times with non-white people. There's even bias in how the programs are being used. And already we're seeing some really cool AI programs developed for use in healthcare settings. But we need to be careful that we aren't building biases into those programs from the start to perpetuate what is already happening in many of those spaces. So how can we combat that? Stopping hacking and misinformation. Haven't seen a lot of this yet, but hackers will figure out how to infiltrate these systems and what protections are in place to stop that. And we know in this field, mis and disinformation are huge problems, and they're already in original data sources and can be trained into the models. So how do we stop that from happening? We also, if we're going to use it, have to proceed with caution. I did a little experiment to test some accuracy, and I asked ChatGPT to write a 3-paragraph bio for me that focused on injury prevention and health communication. And it makes me sound awesome. Like, I love what it put here, but the underlying areas, I'm calling those true adjacent. they're not true, but they're close to being true. An example is the first one. It says, I hold a Bachelor of Arts degree in communication from the University of Pennsylvania. I hold a Bachelor of Arts degree in psychology from Princeton and a master's degree in communication from the University of Pennsylvania. So close, but not quite. It is even has me, as the director of the National Center for Injury Prevention at the CDC. Not true, but sounds great, right? And I'm a consultant for World Health Organization and United Nations, all kinds of things that are close, but not quite, right? I work with those organizations. I am definitely not the director of them. And it's even awarding me awesome grants. So be very cautious, because if people didn't know me, they wouldn't know that that wasn't true necessarily. The other thing that I think, I mentioned earlier, but it sounds factually correct, but it is incorrect. And it's can be particularly dangerous if you don't know what the recommendations are. And we're seeing this a little bit in injury prevention. I have had it spit out information and recommendations that sound good, but weren't actually correct. So you have to really make sure that you're double checking that if you're going to be using any of these programs, and make sure you fact check everything, everything. Hallucination. So this is when there is a confident response by an AI that does not seem to be justified by its training data. And let me give you an example. So a chatbot with no knowledge of the number of firearm related injuries in 2023, right? Because we know it's only going to 2021, might pick a number at random that it considers to be plausible, and then continue to use that number repeatedly with no awareness that it made up the number and that it's not correct. If people are using this program and don't realize the data stopped in 2021, they might not realize there's no way that can be accurate. I need to double check that. And they might start using that information and perpetuating misinformation. It also makes up fake citations, makes up articles and journals that don't even exist, but sound like they could and sound close to what could be. So it's really important to check that. Now, they're aware of this and they're starting to move towards places where you can ask for citations, but even those aren't 100% in my experience. So always double check. And I just want to acknowledge throughout my presentation, I did use some image generating programs. So you could see what AI generated images look like. And this is an example of one using DALL-E. Proprietary content is something else that's really important. So you have to remember that anything you put into ChatGPT or programs like that become a part of their learning and can be accessed by anyone. And I have already heard examples of people putting in PHI and patient data. Please don't do that, because it learns and it can get spit back out. For a short period of time, Italy banned ChatGPT because of this, and Samsung banned it after employees put code that was proprietary to them into ChatGPT to test coding, and it spit it back out to someone else, not through Samsung. So you have to be really aware of those. It's also important to understand that even the creators don't always understand how these programs work. These are just a few examples. I'm not going to go through all of them. You'll have the slides, but they thought they were training the program to reduce the number of sorting errors in a list. But what it did is deleted the list. Technically, no more errors, right? Or another example, played Tetris and not lose was the direction. It played the game and then it hit the pause button on the game, so it never finished. Therefore, it technically did not lose. Those are somewhat harmless, but then when you start to get into things like identifying tumors and it misidentifies them, or identifying people more likely to commit crimes based by looking at previous arrest trends, that might not necessarily be people are more likely to commit a crime. It's people who are more likely to be arrested for potentially committing a crime. We have to be really careful about what we're asking it to do. We're already starting to see litigation. There's authors, artists, and others filing lawsuits against these companies for training on their information that they did not give permission. And there was even a lawsuit on a tutoring firm who was using a third-party software to hire. And in the software, they did not realize that the artificial intelligence had been set to illegally screen out women aged 55 or older, or men who were 60 or older. They didn't even realize that was happening in the background. So you got to be aware and ask questions of the programs that you're going to be using. And then why are these things hot all of a sudden? They were being developed in the background for many, many years, but somewhere someone decided it's time, we're going to pull the plug, even if we don't think it's 100% ready. And now these technology companies are in a race to get out fast and be the one that's first to market. And sometimes that means some of the guide rails are not in place, and that's what we have to be a little bit concerned about. So now that I scared you a little bit, I do want to talk about some of what it can do. And there's some really cool things. And we're seeing AI in our everyday lives already. So we already know that predictive text. We talked about the Google search, even your virtual assistants, Amazon, Alexa, and some of those others. We have those in our homes. Amazon Prime is really, really good at this. They will ask you what you might be looking for, give you gift ideas, items chosen for you, more items to explore. You might also like buy again. They're really good at getting you to buy stuff. Netflix is another great example. It'll give you top picks for yourself, and it'll give me recommendations based on who I watched. This is fascinating because my husband and I share a Netflix account, but we have sub accounts under there. And even the images that it shows can be different. We watched Suits, and for him, it showed the female lawyers, and for me, it showed the male lawyers. I thought that was fascinating. Or even having DJs who will pick music based on what you have already listened to. So it's out there in the world. But for public health, what does this look like? What can it help us do? It can help us save time. It can change the way we do lit reviews. It can help us create personalized interactive learning materials. It can improve our grant and our writing and communication, and it can increase representation and so many other things. So let's look at a couple examples. For those of you who haven't actually used the program before, this is what ChatGPT looks like. This is a slightly older version, but it looks pretty much the same. You type a question in and hit enter, and this is how fast it will give you the answer. I recorded this real time, and it spits it out and it gives me the answer. So pretty quick. So what are some things that we can do? You can use it for writing repetitive tasks. Like I put an example here of writing a letter to an insurance company. I told it what I wanted to do, spit out in seconds. You can generate first drafts. You can generate patient-friendly descriptions of procedures on post-procedure instructions. You can use it to address health literacy by explaining something at a middle school level or an 8th grade reading level. If you are a health literacy specialist, it will not do that exactly, but it will be better than where you started. So caution there. It is improving patient communications. Here is another study by a group who looked at ChatGPT responses compared to physician responses, and also found that AI generated messages were rated higher for quality and empathy. So maybe we can learn from that. You can also start to think about how to organize trainings. So an example for this, I asked it to create 10 catchy titles for a talk on this, and it spit it out. I asked it to write a description for a webinar, and it gave me a description. I asked it to write 3 learning objectives, and it gave me some. I even asked it to create an outline for this talk and what I might want to include, and it put information in there. Back there, I did not use any of those directly. I still feel like you have to know what you're talking about, but it gave me some ideas. And there were some places where I was like, oh, I hadn't thought about including that or including it in that way. So you still have to be able to think about it your own, use it as a tool to help generate ideas is how I think about it. And also aid in comprehension. So this, I asked it, explain how to properly wear a bicycle helmet to an 8-year-old. And it did a pretty good job, but it was kind of long. And so you can use these buttons right now to help train it. You can say, yep, this is good. No, it's not good. Or here's some notes on it. But be aware, anything that you are putting into these programs right now, they are using it to train. So just be aware of that. I then asked it to rewrite the answer using fewer complex words, and it gave me a paragraph that was actually pretty decent. So we can use it to get some ideas. The other thing I wanted to point out here is I asked this question, and then I just asked it to rewrite the answer using fewer complex words. So it's iterative. You don't have to ask the first question again. So it's almost like you're having a conversation with it, which is great. You can also use it to help people understand existing health disparities, or at least how they are perceived in the source data that was put in there. So acknowledging that they will not be all inclusive and that they might have some errors, but might be a great way to start a conversation can be interesting. You also, again, need to watch for biases and stereotypes, but can be an interesting way to start some discussion. You can use it for ideas on how to talk about and share your research. So you can copy and paste sections of a paper in or upload a PDF, and you can ask it to summarize what are the main points of the article. You can ask it to explain the findings to me like I was 10. You can ask it to create 5 Twitter posts from the study, or write a script for a doctor to talk to the parent of a young child about the findings from the study, or even write a letter. The paper I used as an example was on golf cart injuries. And I even asked it to write a letter to a golf cart manufacturer, asking them to improve their golf cart designs based on the findings from the research. And it gave me a great start, right? And it's fast, so it saves us time. We can also use it for lit reviews. So this is an example of a program called Elicit. It's a video that they have on their website where it goes through and you can ask it a question. You can see that it sorts by takeaways from the abstract. It'll link a PDF. It'll tell you what year the study was done, how many citations they were, what study types they were. You can add information in. You can look by authors. There's all kinds of really interesting things you can do to use these programs for lit reviews that I think can have a big impact. And that's just one example. So when you think about ways to use AI, there's some kind of guidelines I think we need to use. So use AI to help create the structure while you create the content that goes into the structure. I think these programs are here to stay. I think they're going to help us do some pretty awesome things, but we need to make sure that what the AI people call a human in the loop, that we are there and that we are being thoughtful about how we're using the programs and how they're trained and what we're asking them to do. You can also think of it like an intern or a co-pilot, get you 70% of the way there, but you need to bring your voice and your expertise. You need to assume the data is wrong and fact checked everything. And we need to make sure that we're inviting a variety of people with different backgrounds to have a seat at the table in the training, in the discussions, and what we're asking it to do. Okay, so I want to talk a little bit about some different ideas from tech. So images are another thing that can have a big impact in our field. These are a couple of the platforms that people are using, but again, there are many new out there. This is an AI generated image of Johann Vermeer's painting Girl with a Pearl Earring. Pretty decent job. This is one that was created of Joe Biden. Not so great. His hands are a little off. It can't get complex. It's great with head and shoulders. It doesn't do as well when we start adding hands and body parts and things like that. Some of these programs you have to go to on their own. Others like Canva and Vyond and Microsoft are incorporating AI and text and images already directly into their programs, or you can do it straight from their programs. So what does that look like when you do this? So I use DALL-E because one of the constant challenges for me as a communicator is to find no or low cost images that show diversity and correct health behaviors. We hardly ever have a budget for a shoot, and I'm limited in what I can find online. So I wanted to look to see, can these programs help me increase diversity with a click of a button? But I want to caution, even there have been some criticisms about not using AI in this way because that's taking jobs away from models and actors of color. So we do need to be thoughtful about that. I definitely want to advocate that we need more support for real photos to be taken, for sure. Hopefully this will be a way to bridge the gap for people who wouldn't have a budget to do some of that until these resources become more widely available. But I am not saying stop doing that. Please keep taking images and using real models. Okay. I also like DALL-E because it's freely available and accessible to more users. There are programs like Midjourney that actually maybe do a little bit of a better job, but they cost money. So I haven't tested those as much. I try and do the ones that are freely available. So this is an example of a photo of a 10-year-old African-American boy wearing a correctly fitted bicycle helmet. That's all I put in. We're gonna zoom in a little bit. So if you take a quick look at these, they actually look pretty good. Now, the helmet isn't exactly right. If you know injury prevention, they, the age might be a little off, right? You don't know if it's completely accurate. The straps aren't right. The helmet doesn't fit exactly right. But compared to what it looked like when I first started using programs, light years ahead. Not quite there yet, but I just did this image yesterday and it's getting better. The straps are actually, it fits pretty well. The strap is close. The buckles usually are, there's a buckle under the chin. It's looking a lot better. So we're getting there. Now, like I said, Head and Shoulders does pretty good. This is what happened when I asked to do a family. And I'm sorry for, should have warned people, they're scary, right? There's extra legs in there, there's no handlebars, the faces are just awful. So we're not there yet in terms of doing this. And to test to see, if they've made any improvements, this was done 6 months ago, the one on the left, the one on the right was done yesterday. So not getting better necessarily in this yet, but hopefully we'll get there. Another option though is to do cartoon versions, and as you can see there are a few versions here that might not be too bad, so cartoons are an option as well. I did want to show one example from Midjourney because I want to show how powerful it can be with some of the paid platforms. So there's 2 photos here. One was generated by AI and one was an actual photo. Quick glance, can you tell which one is which? I had to really look for a second. And if I didn't know that one of them was AI generated, I might not, think, oh, that must be AI. So if you look at it, the one on the left is the actual one that was taken, and the one on the right was created by Midjourney, but it does a pretty good job. Voiceover and sound is another area where we can start to get into, have some things that can be really exciting about that, but some things that can be scary. A few months ago, somebody put out a song, quote, by Drake, that was so good that people who were fans of Drake were really excited about it, said it was one of his best ever, were excited for when the new soundtrack was going to launch, but it was all fake. It was somebody putting in that asked the platform to create a song that sounded like Drake, and it was so good it fooled a lot of people. Kind of scary. So we can see an example of what a video looks like. This is a video that was created for a Star Wars trailer in the style of Wes Anderson. So Wes did not create this. Somebody else just created it.
In a galaxy far, far away, prepare for a reboot like never before. This summer, Wes Anderson brings you a side of the Star Wars universe you've never seen before, the Galactic Menagerie. Join this ragtag crew of unlikely heroes like never before.
So pretty good,
this summer,
but not great. That
in a galaxy far, far
using Wes's work. There are programs like Beyond where you can actually go in now and do the same thing. You can type a 1 or 2 sentence prompt and it will create a video that looks like this for you. It's amazing actually what it can do. They are not perfect, but they have, if you pay the upgrade level, they actually can translate a video into 70 different languages, including dialects, and it will even translate the voice. I tested it and I translated a video and it did it in less than 1 minute. And it included even changing the text that appeared on the screen into that new language. It does say you have to check accuracy, and I have not been able to do that yet, but it was really impressive. Okay. So what's next? Already we have WHO who's creating virtual health workers to talk to people through AI to dispel myths about COVID-19. We have driverless ambulances that are being created. We have companies that are working with assisted living facilities to have cameras in the room so that they can track things like, is the resident all of a sudden going to the bathroom more often at night, and what might that mean for their health? They might not tell their doctor about that for weeks, but now these programs might be able to see it and start using things more quickly. Or even if there's a possible fall risk or things like that. I mentioned that we would talk about customized GPTs. These are really interesting because they launched just a couple weeks ago, and they are available only for paying customers, but they are trained on data sources that you put into it. So you can put the information in and you can train it yourself, which means you know what's in there. You can keep your data private if you want to, so it's not shared with builders. And you can have internal only GPTs. This is an example of one that was created by a research lab where they put all of their own research in. There's a link to a video if you want to watch that. We're getting close on time, so I want to stop here soon, but you can watch that, and it shows how you can ask questions based on the presentations and the research from that lab. Okay, so just again, reminder that humans are still needed. It is really important. I thought this was funny. We have this AI vacuum, but we have someone sweeping in front of it, right? It is always going to continue to still be important to have humans in the loop, but AI, it's here. I attended a couple of weeks ago an AI Impact Summit, and there were two quotes that really stuck with me. It's no longer if or when you should adopt AI, but what you should adopt. And AI won't directly replace humans. The humans that use AI will. So after this talk, what are you going to do to learn more about AI? How are you going to use it? You don't have to start all at once. You can spend an hour a week just learning about it, playing with it, thinking about it, how it could help your work. But I encourage you to start thinking about it. If you want more information, you can go to our website, which is certsy.org, which has information on AI and artificial intelligence as a start. And here is my contact information. And I know we have a few minutes for questions if people want to jump in there, or Laura, if there are any that came in while I was talking.
There was one question that came into the chat, which was, if someone makes a suggestion which will be used for future training, is it tied to them via an IP address, email, etc.?
Oh, that's a great question, Pam. And I'm honestly not 100% sure about the answer to that across all of the different platforms. So I would assume that anything you put in there can be used and may be used. So when you're interacting with them, you actually, when you sign up for it, you sign up right from the beginning to say anything I put in here can be used. So I would assume that yes, they're using your information.
Awesome. If anybody else has questions, feel free to put them in the chat or raise your hand and we can unmute you.
Either I scared everybody or I got them thinking about all the different ways they can use it. Yes, AI can be a little concerning, but I am blown away by what I think it's going to be able to do. It's going to take away some of the work that can be done by the computer, and it's going to allow us to think about things in new ways. So I think I'm really excited about where we can go as long as we are aware of what our limitations and risks are, for sure. Graham mentioned Vyond. There are many video creation platforms that can do this type of thing. We use Vyond, and we do think it does a great job. Standardized practice recommendations for states. Not yet. I started looking at policies and they are all over the place. I will say a lot of the people who are making policy decisions right now about AI are people in the C-suite and people in IT and tech. I heard a presentation from a healthcare software program that works with healthcare organizations, and I asked about whether or not they had looked at health literacy specialists or talked to them, and they had not even ever considered that. So there is a space for us as health literacy specialists, as injury prevention, different voices, aware of different disparities. We all need to be having conversations because people are not thinking about that in the way that they could be just quite yet.
Okay.
Thanks, everyone. I'm definitely available if you have questions, so reach out and enjoy the rest of MIPA.
Yeah, thank you so much, Tracy, for a great presentation. We are about to start a 15-minute break, and then we'll return back to the conference at 1:15 Central, 2:15 Eastern, and you have two breakout sessions, one about harm reduction strategies for marijuana edibles, and another about falls reduction. And then we'll have another 15-minute break, and then we have our closing keynote with Dr. Lois Lee about pediatric firearm injuries and fatalities. So we'll see everybody back in about 15 minutes.